So I'm going to be giving a teaching session on how to use the IV pump. This is used to infuse the correct volume of fluids for our patients, and these pumps are kept in the PACU unit. Just as you go into PACU, there's an equipment room which is situated on the right hand side, and they're kept plugged in because that preserves their battery power. And these pumps can work for 4 hours without being plugged in, but it is best practice that we keep them plugged in when we are using them, unless if we cannot do so. So firstly, before we start using this machine, we need to do a few security things, safety things. So we need to check that the cable, which is the electric cable attached to the pump, is not frayed, and in which case it is not. The 3 pins which will go into the socket are also looking good, they are not bent, so this machine is good to go. Over here on the power point, I'll just make sure that the power point is turned off, otherwise I might get electrocuted. So turn that on, and on the machine here there's the on off button which is situated on the right hand side here, so I'll turn that on, and that's the beeping sound that comes on as the machine turns on. And then at the top it tells me to perform a speaker test. Alright, so I'll press here where it says press and hold the key, so that's the speaker test key. So I can certainly hear, and the machine is asking me if I can hear that, and I'll confirm by saying yes. And it's just telling us that it was made by Baxter and it's an IV pump. It's charging, which is good. So on the extreme right here there's an arrow which is for a new patient. It has quickly gone on to primary. Okay, so that's all right. So I'll press primary there because that's the it's just a primary fluid. I don't have 2 fluids running concurrently. So on the pump here, right at the top, there are 4 columns which has got main display, volume history, alarm silence, and the backlight. The main display is where we are. The volume history, if I press that one there, because I haven't given anything to this patient, it will just display 0. And then alarm silence, if this was beeping, this is what I would use to silence the pump. And the backlight is just to dim or brighten the screen itself. Alright, and there are numbers here where I will select when I need to put the volume that I need to be using. So we go back to the main display, which is where I want. So I've just pressed that left hand one. So as we know, our fluids, they are charted on the prescription for the patient, and we'll follow those 5 rights to make sure we've got the right patient, the right fluid, and IV fluids in here at Southern Cross, checked by 2 nurses. So we'll do that, and we'll check the patient to make sure that it's the right patient. We'll check the IV access to make sure that it's patent. So we do that by flashing, and we'll also check that there's no phlebitis. Okay, back to our pump. It's beeping because I haven't pressed it for a while, so I need to silence the alarm there. Alright, so this is our fluid. It's been checked, and there is the tubing, the IV tubing has been attached and already been primed. Okay, so on the tubing there's a blue clamp which is here. Just make sure that it's not kinked. So this blue clamp, the tubing can freely move within it, but when we are needing to put this onto the pump, it needs to be the tubing needs to be slid right up to the end where it can't move freely, and the part that goes into the pump to load it is located on the left hand side of the pump, my left hand side over here. Okay, so for me to be able to load this tubing, I need to press here where it says open. Alright, so that sound is indicating that this is opening, and I need to make sure that this is properly positioned. So it's showing me that it's going to the patient. So from the top there, it's coming to the left hand side, and I'll just put this blue clamp in here, push it all the way in, give the tubing a bit of a pull, and it's saying it's loading. Alright, perfect. So it will stop making those sounds when it is loaded. And again, because channel has been stopped, it's beeping, I press the alarm silence. That will quieten the pump. So my fluid it's prescribed to run at 100 mils an hour. So I come onto here, I just press the primary button, and I want the rate to be 100. So I press here, and the volume, I'll say it's 900 mils. So I come and so coming from the rate right at the bottom, I press this arrow because I'm done with the rate. I'm now wanting to put the volume to be infused. So just press 900. Okay, so a few things to be aware of before you start the pump. You need to make sure that you unclamp here, otherwise the machine will beep. It will show that there's downward occlusion. As I said, we've already flushed the IV lower of the patient. So what we need to make sure now is to connect this properly. The best thing, if patients have got peripheral lines, is for them to have the IV extension set. So our patient, we assume that they already have that, and we'll connect this, obviously after doing the cleansing with the alcohol swabs. So we'll connect this, and for the sake of teaching, I won't unclamp this so that I can show you what you do to troubleshoot if the machine is saying there is occlusion. Okay, so we are going to press our confirm primary button because we've put in this one information at 100 mils an hour. We want this big to run, so confirm primary, and the machine will tell you step by step what you need to do. Press that to begin primary. That's our start button. Okay, so that beeping sound is actually telling me at the top there's a red highlighted red line there which says downstream occlusion. What it's telling me is that I've forgotten to open this one, the clamp. So I unclamp there, and we go again. So let's see what happens. Press that to begin primary. We'll do that and see what happens. Okay, so the fluid is coming down. Fantastic. I'll press stop here. So in the event that I need to take this patient to the bathroom or maybe to x-ray, they don't need to take the fluids with them. So we've got the option on this machine to put the machine on standby. It will keep all the record of how much fluid was left in the bag and how much fluid we've given. So I come on to pro stop here. I've pressed that, and then I come on to options. I beg your pardon, let me go back to the main display. So we go on to primary here, and then it will give me this screen which says change mode. That's what I'm after, so I'll press here, change mode. And if I don't need to change, if I've pressed that by error, I press the no change, but I want actually the machine to give me more options. So I come on to the page up option, and over there it's highlighted the label line. I don't need to label this line, and I can also prime the tubing using the machine. I don't need to do that. I want to actually go on to standby, so I need to move the arrow. So this arrow here, I need to move. I don't want to prime, it's on prime, and then go on to standby. That's what I want. So I come on to select. So I select there. On the screen is asking me, do you want to put this channel on standby? That's exactly what I'm trying to do. Yes. So it has put the machine on standby. It will just have this hexagon in red, and it will indicate that it's on standby. Okay, so we've come back from x-ray. The patient needs to resume their fluid therapy. I come back, do the cleaning of the IV lower, flush the line, and okay, I come here and press primary. The same rate is showing, and there's still close to 900 mils left in the pump. Okay, that's the one way we can use the pump, to put it on standby. And sometimes the lighting on the screen may be too much for the patients. Like at night, some people, they don't like light, so we can use this backlight function here. This is brighter. If I press again, it goes dim. All right, and there are a few key functions at the back here. So by the handle here, there's the volume button. If the machine, when it beeps, is too loud, we can actually just roll this wheel downwards, thus reducing the volume. Or if it's too quiet and we're having trouble hearing the machine when it beeps, we need to come up. That's how it works. So the minus is at the bottom, the plus at the top, and right at the back there's this little button here which says panel lockout. So this will it's a tamper-proof button. If I press this one, I won't be able to change anything at the front because the panel is locked out. So it's one button that we need to know. If you're having trouble pressing any keys, or if no keys are responding, it's because that has been activated. All right, and the machine will alarm for a number of reasons. It could be that the patient may be moving if the IV lure is maybe in their ACF or on the wrist joint. If they move slightly, these machines are very sensitive. They'll pick that there's an occlusion and it will show occlusion. So it's always good that we come and check. Sometimes they do beep because the patient, the cannula is tissued. So we need to come and check. If it's just a matter of the patient having moved, and that can easily be fixed by just repositioning. Sometimes there's air in the tubing. If I overestimate how much volume there is in the bag, there could be air in the tubing. So in that case, we've got the option of priming using the machine itself, using that same function that I showed you earlier, which is, so confirm primary. I'll take you back to that one, and we say we want to change the mode, and we page up. So on here, the second function up is to prime. So if I wanted to prime, I'll just go on to select, and you see that for safety reasons, this machine reminds me that this set must not be connected to the patient. The reason being, if I'm trying to clear the air and this is connected to the patient, obviously that's not a good thing. The patient shouldn't be receiving air that has filled up the line. Okay, and then to prime it, you need to hold, you press prime, hold prime key to prime it. So that's what you do, prime active, and it reminds me again to disconnect this from the patient. So when you're done, you just press the done key there. All right, and if there is any occlusion, which could be because when I started the pump I forgot to turn this on, again it will just say there's downstream occlusion. It can also pick that there's upward occlusion. For instance, if maybe this has kinked for whatever reason, and I want to press that here to show you that the machine will also be able to indicate to me where the occlusion is located. I hope that my kink is enough to be causing the occlusion. Okay, so it's saying air detected, and it's asking me, do you want to advance the air to view the bubble? That's not the problem I was trying to troubleshoot, but anyway, I'll just talk about the air. Do you want to advance the air to view the air bubble? Sometimes it's hard actually to find where the air is. It could be within the machine, and what might be the best thing is just to prime, although you do have the option. If it's a small bubble that has been detected, yes, you might want to choose to advance the air, but you can also choose not to, and just disconnect this, let the fluid run through, and then start again. And as I said at the beginning, these machines, they do save us. They ensure that we deliver the right amount of fluid to the patients. We need to look after them by just cleaning them in between patients and keeping them plugged in, and they're kept in the PACU unit. Thank you.